consists of our nurse managers. So we have a great group of nurse managers. It's really an extraordinary group of talented and committed leaders. And really, they are the foundation of Laguna Honda Hospital. We truly could not perform our mission without these individuals. And, you know, virtually every one of them has a great story and great contributions. And we really wanted to use this opportunity to recognize their great efforts. Next slide. So we recently implemented a new department. We mentioned it during the last meeting. It's the Department of Equity and Culture. This department really is off to a great start. You know, and like a lot of places, there's a tremendous amount of work that needs to be done to advance equity. And although we at Laguna Honda have done a great job heretofore, there's still a lot of work for us to do in this very important area. You know, one of the most important tasks related to this effort will be launching the Equity Council. And this council really will include representation from all of our departments. And so we're really looking forward to getting those members and assembling that council, and then getting on with the busy and important work related to advancing equity. Next slide. So as you can see, we welcome every opportunity at Laguna Honda to celebrate. We recently celebrated Lunar New Year in the month of February, as well as Black History Month. And with March, we're kicking off a celebration of Women's History Month. And this is something that we're really looking forward to in terms of celebrating women's history, mostly for obvious reasons, but for one reason, in healthcare, women are so well represented in leadership roles throughout the industry, and it's really no different here at Laguna Honda. You know, 4 of our 6 executive leaders are female, and as well as a significant portion of our physician leaders are female as well, and that's no accident. I mean, this is really a function of, you know, the level of talent and drive and determination among this select group of individuals. So, you know, we want to really highlight and focus on all the great work that all of our wonderful women are doing here at Laguna Honda. And so we've already started with, you know, getting, you know, putting up posters based on positions and or different stories that different individuals have made great contributions. We also were invited to participate in the Women of San Francisco. There's putting together a conference call, and we were invited to participate by way of having 5 of our select individuals to really talk about their story and also talk about what their experience and our experience has been during the pandemic. So that event is happening on the 24th of March, and we have 5 individuals who've been selected, and there'll be a call-in where people can actually call in and participate. So we will make sure to get the call-in information for the commissioners in case you want to listen in as well. And with that, I'm going to turn it over to John for the care experience.
Now, can we go back one slide? Truly, commissioners, I'm not that narcissistic. Look at that man up there. So one of the things for Black History that we wanted to do is to make sure that all of you got one of our shirts for Black History. We every year we celebrate. We did a very small celebration this year because of COVID, so we weren't able to do what we usually do. I remember last year we did the largest celebration, and then 4 days later shut down the hospital because of all that was happening with COVID, and we would have not been able to do that if we would have started a little later. So we want to say thank you to all of you for your continued support. So I've talked to Mark. Each of you will get this Celebrate Black Joy t-shirt. So thank you very much. I'm not like Oprah. I can't give you a car or anything like that. We can't give you a t-shirt, though. So can we do the next slide? Okay, so good afternoon. I'm John Grimes. As we said, I'm actually the Chief Operations Officer here, as well as over our COVID incident response. And so today I'm going to give you just a high-level review of most of the things that I'm talking about. One item I will get into a little more detail on it. So right this particular slide, we are resuming our visitations at Laguna Honda. As of March the 3rd, we started those. As you know, we have 3 types of visitations. We have outdoor, window, and vehicle visits. We actually had to put those on pause until very recently because of the uptick in cases that Michael talked about earlier. So we are so happy to start those back. We also will be, we have been in conversations with C3 to start to look at indoor visitations for our residents. And we have a place that we have picked out where those can be held. We actually are waiting for the new AFL and change in the health order so that we can put those things in place. We want to make sure that all of our visitations are safe. So when we put the pause on, we knew how hard it was for our residents. They were able to have visitations with their family, and then for the holidays, we had to shut everything down. So we're really excited to do that. Next slide, please. So part of those visits, we are actually having that help with our reopening. And we want to do this in a very planned, very metered way. We have since opened, as the slide says, 17 of our 20 inpatient clinics, including gastronomy, whatever Willie said, and endocrinology, dental, usually not, does that, We have not opened the pain clinic or our ENT clinic, but we are moving toward those. The other thing that we've opened, we are so happy that right now, as Michael said, we have no residents in our COVID unit. About a month ago, we actually had so many patients, we surged in that, and we had to actually open up another side of our COVID unit. So we're so happy to be down and not have anyone in-house right now. And all of our units are on green. And I think we have one staff who's left. We've reopened the pool for residents, the hair salon, as you saw, and then we're starting to actually meet on Thursday to talk about what other services that we can bring on in a very planned way. Our concern is we're hearing of a 4th surge, and so we want to make sure that we're not doing too much so very quickly. Next slide, please. So this slide, I'm going to get into a little bit more detail on it. To give you a little background, I think last year in June of 2020, I presented to you in the full commission budget finance committee meeting about approval of expenditures of funds for a food service program to provide food for our kitchen, for our residents during the kitchen remodel. So while I'm getting into more detail, we thought that was running fairly smoothly. I talked about this before, but to give you a little background, when we built the new hospital in 2010, the hospital was built and was considered LEED Silver certified, which meant essentially that the hospital was made out of green materials. And the floor of the kitchen had a high glass content, which is not conducive to heat, weight, or water. So the kitchen floor has been leaking all over the place. I have engineers that are emptying out pans of water every 2 days. So we came to the full commission and talked about bringing on a provider, FSP or food service partners. We were very excited about them. They had a very good resume. They are actually in Kaiser. I think they provide food for 32 Kaisers in Northern California and provide food for Napa State Hospital. We soon came to find out that there were certain differences in the way that our computerized system called Seaboard worked. They have the same computer system. This is one of the issues. But where ours does individualized plates for our residents and looks at food allergies and preferences, theirs did bulk food. And so that became one of the problems. It became a larger problem when we started to look at how we would take on that food, because one of the things that we wanted to do is make sure the food was safe for our residents. So we have to look at time and temperature, and in order to be able to produce the food for our residents, we would have to have really a refrigerated tray line system, which General actually has, but I think it's about $4.5 million. We didn't have the ability to do that. Also, in the options that they provided, they weren't able to provide a chopped option for us or a ground texture. And as you know, many of our residents have had strokes, and actually that was something that was important to us. So we actually could not, after several months of working, get beyond the differences. So we terminated the contract for convenience without prejudice. And so now, to bullet 2, what we are doing, actually bullet 3, we're proceeding with a mobile kitchen that will be run by our food services department. Unfortunately, I didn't think of this idea a year and a half ago when we were doing that. And so this is a shed, but it's actually a big compartmentalized structure that you can actually build to specifications that you need. And that's what we'll be doing. So it will be on site here. We'll be able to use our own recipes, use our own current staffing. We can transport the meals much quicker. So this is a better option for us. We think the project will take about 4 to 6 months, and we anticipate, with fingers crossed, that we will have that completed this year. So that's it for the kitchen floor project. So next slide, please. The next thing we're going to talk about, this is a little bit of a misnomer, and I see a typo, which I missed. I apologize. We actually are restarting our Environment of Care Committee. We have actually, throughout the pandemic, continued to do rounds. The engineers do rounds, nursing does rounds, environmental services do rounds, and actually in our kitchen, they do daily rounds. The other services do weekly rounds. The Environment of Care Committee actually looks at the compiling of that information, looks at the common themes, what we're seeing, and so that we are restarting. We actually had our first meeting just yesterday, and so we're bringing that back online so that we can make sure that we are paying attention to a number of the items that are happening here at the hospital. So I think that's it for me. Thank you.
Good evening, Commissioners. Naz Chief Quality Officer. I wanted to share with you a staffing update for our department, and a thank you to Michael for highlighting this as part of the CEO presentation. Elizabeth Schindler, who is a known and welcome face here at Laguna Honda Hospital, she's been with us for about 7 years now. She is our new Director of Performance Improvement. This is a huge step in terms of the restructuring of the department. Elizabeth will oversee the performance improvement team. This will consist of 6 full-time staff that we're actually in the process of hiring. And I'm very excited to have her as part of the team. Her history here at Laguna Honda Hospital, she started in the administration department. She helped roll out e-clinical works within the facility, and then also rolled out Epic with the facility as one of the super users. She was also a key team member in the Strategic Performance Office, which was our lean management office, which rolled out lean principles here in the facility. And in that work, she partnered strongly with nursing and naturally transitioned into a role in the nursing department, leading their quality improvement work. So she's a natural person for this performance improvement work and developing this team. She has also hit the ground running and starting to prepare us for our survey readiness work to get us ready for our annual survey. Over the next couple of months, I hope to share with you many more members that we will be onboarding, but I'm so happy to share with you regarding Elizabeth. You will see her in upcoming Health Commission meetings, sharing presentations with you in terms of the work that her and her team are doing, and I hope you will congratulate her with me. Apologies on her new role. Thank you so much.
Thank you, Naz and John. And with that, we will try to answer any questions you may have.
Okay, thank you very much for that report. It's a very sort of happy report, considering everything that we've been encountering over these last several months, and really, again, congratulations to all there for continuing to move forward and having the celebrations that are necessary, I think, to keep up the morale and to recognize the good work that is still going on. And particularly glad to hear that there were only 5 new cases in the month of February. That's amazing. And again, another, I think, a tip of the hat to all of you for making sure that our patients, or our residents, continue to remain safe. And hopefully, even as things open up, we'll be able to continue to keep up that diligence with regard to both staff and the residents. Are there questions from any of the commissioners?
Commissioner Guillermo, both Commissioner Green and Chow have their hands up.
Okay, great. So why don't we go ahead with Commissioner Chow?
Oh, thank you. I have to press the right buttons. I did find the hand. Thank you. My first question actually was trying to understand on page 9 on safety, because I didn't have the article, what the quote from Dr. Hathaway was in reference to. I'm not sure that, there must be a context there, because it says it was a party for us when the one patient left. So it seems to me saying that when a patient left, then we were happy, but I'm sure that's not what it meant. So I was just trying to understand the context, because I actually didn't have a copy of the article.
Want to take that, Woman?
Sure. It was pertaining to the last COVID positive patient leaving the COVID.
Leaving the COVID ward, you mean?
Yes.
Okay, because unfortunately, that's not the way the quote read, and so I wasn't quite sure what we were having a party of, but I was sure it was very important.
So we were having a party because there was no longer any more COVID patients in the COVID ward.
No, I think that's great, and I'm sure the article said it. The way that it was abstracted caused a little confusion. And I also compliment you on the new I guess format in which the report really reads well as it also flows with your presentation. And so I was quite curious about the kitchen floor project, that if we're running a mobile clinic over in the 5th floor parking lot, how do we assure that the food is as warm as it should be?
So we have a better ability to do that close to us. But the cooks, the kitchen staff, can you hear me okay? Commissioner Chow, can you hear me?
It's a little, when you spoke up, that was better, but you were a little distant. That would be nice if you're right by the mic. Thank you.
All right, this may help. So actually, we will do the same thing that we currently do. I don't know the cadence of it, but the kitchen staff take temperatures of the food all the time. I think every hour they are, and I'll correct that if I'm wrong. I'll ask them after this. I'm not there all the time, but they would still do the same procedure that they do currently. They will make sure that they're keeping the right temperature. That's why this other system where we had to bring in, have to keep the food outside was a problem, because they're so aware of, you know, infection control issues and getting our residents sick, that they didn't want that, and we didn't have the money to have the refrigerated tray line. So we would still follow our same procedures that we do right now, and they would do the time and temperatures that they do. They have special markings that they do to make sure that at a glance you can see if something is a little out of date, so if they've been missed. So we would follow the same procedure.
So is this further for, you know, in terms of your need to get the food to the residents as versus where the current kitchen is? And it sounds like our other contractor could not do this as easily because it would come in a different fashion, and you wouldn't have microwaves to heat it up or something like that. So is this fairly close, like similar to where the kitchen was before? And then if you're in a shed, are you going through the outside? I'm just kind of concerned because food is so important to our residents.
Yeah. You know, we're at the very beginning stages of this to look at the feasibility on how we're going to do it. Where they're looking at placing the trailer right now would give them a direct route in, but there's other problems with that. So what we're trying to do is to make sure that we can, you know, that we're taking all that into consideration. So we want to do the most direct route. To answer your question, it's a little further away than the kitchen. And so they would have to go through the old hospital. And so we're actually looking at what is the best option right now. So you're kind of getting this information hot off the presses. We just did a walk on Friday, so I can come to you and tell you which option we chose. But definitely we want to make sure that they get that at temperature, that no one's sick when they get the food.
No, I appreciate that and appreciate the update in terms of what you have to do right now. And if you can give us an update at our next meeting about the options you've chosen, that would be really, I think, useful for our information.
Yeah, I sure will, Commissioner, I sure will. Thank you.
I don't have any other questions.
Okay, Commissioner Green?
Yes, well, thank you. This report is not only informative, but it's really enjoyable to read and exciting, because I think you're bringing to life all these wonderful events you're having and the holism of the way you're managing things. So I'm very appreciative of this. I really look forward to it. I guess I had two questions, and they're a little bit diverse. One is, I'm really curious to hear your analysis of the relationship, if any, between the vaccine rollout and the dramatic fall in cases, and whether in fact there are other aspects of what you're doing that might contribute, because I was trying to correlate the graph of when vaccines were given to the staff, let's say on page 7, and then one for the residents, with this the curve of the fall of cases. So it seemed like, given that there's a certain amount of time it takes for the vaccine to actually produce antibody, I wondered if there was more to it than that, because it seems like you know, your numbers are terrific, and yet they should, in theory, unless there's a fourth surge with resistant organisms, it should even be better going forward. And I wonder if what your analysis of that is, and what you think the other factors that might have come to play here to contribute to your numbers this month, February, would be.
Yes, you know, it's a great question, and it's certainly one that we thought a lot about. And I would say probably the best answer would be is probably multifactorial. I think, though, that the vaccination is high, you know, among causative effect. For sure, because if you just look at the timeline in terms of when we gave the vaccine and a couple of weeks later, you know, things really started to happen positively. So it has a tremendous impact. But, you know, when we look at other areas of the city and the country, and, you know, of course, we're in a serious surge. I mean, you know, the surge, you know, pretty much subsided. So that played into things as well. I've heard some mention the potential of seasonality, some seasonal impact. and that, could be a factor. We haven't done anything differently in the way of our protocols. In fact, I wouldn't say we've relaxed our protocols because we haven't, but we had an enhanced protocol that we had implemented when we were seriously in the surge, and we pulled back from that. And so that's really the only thing different that we've done in the way of protocol. So if I had to guess one of, the major impact, it would be the vaccine. That's really what I would, just anecdotally say is, what's driving the decrease. And we're really happy to see it.
And then I guess the correlate question is with regard to testing, because I think all of us are very concerned about this question of whether a fourth surge is actually coming. And obviously, the way we might identify that is through, testing quickly. So is there any, I just wonder if you could refresh us on what your testing protocols now are for residents and staff, whether they change with the kind of loosening of restrictions, and what would trigger a more aggressive frequency of testing, especially for staff.
So, and I'll let Wilmy talk a little bit about testing on the resident side, but no, please.
So currently, we are still on twice weekly testing for both residents and staff. And we implemented this twice weekly testing, I want to say before the holidays, or right around the holidays. We are actually discussing possibly reducing the frequency of testing. So we actually have that conversation today. And there's a lot of moving components to it. What the availability of the test, what type of tests are available to us, compliance of both staff and residents. I can tell you that our refusal rate of residents have dramatically increased in the last 3 weeks because, to be simple, they are tired of having their nose swabbed twice a week. And then also, of course, seeing positive cases, the positivity rate in the community and in the Nevada. So right now, the positivity rate is essentially zero. It's been zero for the past 2 weeks. And it's the ultimate low that we've seen in San Francisco. We don't have an answer. We do know that we are going to abide by CDC's requirements. And right now, they're requiring once a week testing for staff. They do not have any requirement for testing, screening testing for residents. With the discussion today, I can say that it's divided. That some staff want to stay conservative, a few members want to stay, want to be a little bit more. And we haven't quite come up with a decision yet.
And one thing I will add is that some weeks ago, a couple of months ago, we transitioned from PCR testing to FINEX testing, or with rapid test on the staff side, and that's made a tremendous difference in terms of just being able to get results quickly. But other than that, we continue with the same cadence of testing.
And I guess my final question is, now there's these CDC recommendations about how small groups of vaccinated people can be together unmasked. And since, you vaccinated your residents, will that change anything about the residents using masks? I'm sure for some it's a real difficult endeavor. And I'm wondering if, what your thinking is on that and whether that's even worth pursuing, because it is kind of interesting when you have all these vaccinated people in one place and now the CDC is saying liberalize.
Right. Well, I think we all can appreciate the fact that although we have had masking in place for residents, not mandatory, but highly encouraged, there's still a large number of residents who either don't mask or even if they do mask, it won't stay on consistently. So, and I think given that, this is a discussion that we need to have as a leadership team. We're very appreciative of the fact that our residents have really been as compliant as could be expected, and have been really kind of weathered this storm with us. But I think we're at a point now where we can really start thinking about making some allowances, if you will, along these lines. And I think this is a good time for us to start having some discussions about it.
Well, thank you very much, and it's so encouraging to know you're already on top of all the things that I think we're all scratching our heads about in our own environment. So thanks so much.
Thank you very much.
Thank you, Commissioner Green. I had a couple questions, and actually just to follow up on the question the last question that Commissioner Green had, in terms of what you do decide to do on the masking protocol within Laguna Honda, it would be another one of those instances where whatever Laguna Honda does is what people around the country are going to be watching in terms of what the outcome will be. Particularly given the recency of the CDC guidelines. And so just something to be, aware of that. And we've been fortunate that pretty much everything that you've agreed upon in terms of your leadership has actually led to a very positive outcome with regard to COVID and a number of the things that we're watching. And so it'll be another one of those to be paying attention to, and if things work out well, another reason to celebrate, hopefully. I did have another question about the vaccine. Well, so the staff, the 280 or so staff that have not been vaccinated, one, are any of those frontline staff? And then two, is there sort of a breakdown in terms of what the primary reason is that that these staff are reticent or unable to receive a vaccine?
So I don't know if any one of you want to comment?
Michelle.
Yep.
Hi, good afternoon. This is Michelle Fouts, and I would say the reasons for not getting vaccinated among the staff are extremely variable. Some and really line up with things that you hear in the press and among other groups. Concern about messenger RNA technology. Some folks have conditions that make them concerned about taking vaccines in general. We've had people delay due to pregnancy, and yeah, so it's variable.
I think though, and I agree that it is variable. I think that because the side effects from the vaccine have been really so nominal, and the fact that now we have a vaccine that's only one dose, I think as time has played out, I think the staff who have declined are really, although they've been impacted by, negative information that they've gotten maybe in social media or in some aspects of the media. I think the fact that the experience overall has been really good, it can only be a positive in the minds of those who decline. So I think we'll get a few more as time goes on. At least I'm hopeful that we will.
Great. And but otherwise, percentage-wise, it's still a low percentage of those who are unwilling or unable to take the vaccine relative to at least what we've been hearing in terms of the general health caregiver population and their reluctance or inability. So another thing to, I guess, celebrate, and hopefully those 280 folks will respond actually to the Johnson & Johnson or to their colleagues who are showing the positive effect of taking the vaccine. One last question on the kitchen floor project. So this shed that you're going to be putting into play, is that, John, is that a temporary situation until the kitchen floor is repaired, or is that something that might end up being a semi-permanent situation if it's successful?
Very temporary. And part of the issue is the placement of where we're going to have it is going to block some parking. So this actually kind of gets to Commissioner Chow's question about the direct route. So no, it's going to be very, very temporary until the floor is completed.
Okay, great, thank you. Looking forward to hearing more about how that's gonna roll out.
And if I may, Commissioner Guillermo, as we move forward with the next items, there's a couple presentations, and I'm also noting we're an hour already into the meeting after just one item. So if the presenters could be aware of time, not you all commissioners, but I think that might be appreciated. I didn't mean to
Yeah.
your flow.
Okay. No, that's fine. We do have though the regulatory affairs report. Is that next or is that after the presentations?
No, item 5.
Okay, great. Why don't we go ahead?
Okay, good evening, commissioners. Nice to see you all again. So I wanted to share with you the Quality Management Regulatory Affairs Report. It reflects the activity for the month of February. In the month of February, Laguna Honda submitted 16 facility reported incidences, and we had 2 anonymous complaints shared with us that were reported to CDPH. You have the breakdown in front of you among those 18 total cases, and what they were, 13 of them of allegations of abuse, 1 theft, 2 adverse events, which were major injury events, and then the 2 anonymous complaints. During the month of February, we had 2 abbreviated site visits. This consisted of surveyors coming on site unannounced, one of which was a follow-up of an anonymous complaint. The surveyor shared that preliminarily there were no findings. We have not received the official 2567 just yet. The second visit was to follow up on 5 facility reported incidences. The feedback there as well verbally was no findings, but again, we are waiting the final 2567 from the state. One big update I wanted to share with you today is as of Monday, we received guidance through an all facilities letter that CDPH will be resuming their annual relicensing and recertification surveys beginning in April. And they will actually put a pause on the mitigation surveys that they've been conducting over the past year that have focused on the COVID protocols. And so their focus will be on high priority facilities. Our assumption and feeling here internally is that Laguna Honda will be considered a high priority facility. One, given that we are overdue for our annual recertification and relicensing for the skilled nursing facility. And additionally, because our acute recertification survey in 2019, if you might recall, did not complete due to census in the acute facility, in the acute beds. So it is likely that Laguna Honda will be one of those priority facilities, and the survey readiness has begun as of last Friday. And so we will begin our rounding and observations over the next several weeks in partnerships across the facility with nursing, medicine, pharmacy, quality management, facility services, EVS, and so forth to ensure we're in compliance and ready when the surveyors come on site. And we'll, of course, keep you updated as we know more. Are there any questions on the report or comments?
Are there any questions from the commissioners? Okay, great. Thank you for that report, Naz.
Would you like me to call the item, Commissioner Guillermo, or would you like?
Sure, sure.
Sure. Item 6 is a presentation on drug regimen review.
Okay. Is that you, Michelle?
Yes.
Okay.
That's real good. There we go. So this is a follow-up presentation from, I believe it was November when I was here last. Next slide. So there's not a lot of change in the presentation other than the numbers. So we'll go through those quickly. Drug regimen review requirements. The pharmacist is required to review the medication regimen every month, identify areas for improvement, and communicate those findings. Providers are responsible to review the recommendations, respond to those recommendations, either by doing what was requested or providing a brief note to say why they disagree with the recommendation. And then medical director and administration receive reports, support the process, and follow up when necessary. So in November, we're always looking back 60 days, and so at the end of February or beginning of March, we're looking back at December. So 3 months previous, we would have been reporting on data probably from August at our last presentation, and at that point, our response rates were a little lower than ideal. We have done some work to improve those, working with medical staff leadership and with the pharmacists and also nursing. The report, the graph shows in blue the physician or provider response, red is the nursing response rate, and then beginning last year, we separated out responses to recommendations related to psychotropics as part of a plan of correction. And those typically follow pretty closely with the provider response rate, although they do include recommendations to nursing. The barriers, this slide is the same, except I've added one, and actually I'll go back. We saw a little dip. We did really well, had some improvement for September, October in the mid 80%. In the November, which we would have looked at in January or in the beginning of February, we had a bit of a drop. And so did some review with medical staff leadership around that drop to understand better. And we were able to identify that we really have a challenge when a provider goes out on an extended leave, whether it's planned or unplanned, but if there's a gap in provider really paying attention to the drug regimen review for a prolonged period of time. So with that in mind, we added here this workflow, and so our focus in the last month has really been how do we improve or identify when there's an extended leave and provide coverage for that drug regimen review. So again, these countermeasures are similar to what was in the previous presentation. We did add here, the recent additions are to develop workflow for coverage during extended med staff leave, whether it's planned or unplanned, and also develop standard work with nursing around the communication of the drug regimen review findings that are specific to nursing. So we feel like we've had a positive response to that work. I'm continuing to work with med staff leadership around refining and putting in place a more permanent solution to cover those gaps in coverage. And I think with drug regimen review, like many things, it requires our constant vigilance and having all of our staff, so pharmacists hearing from me on a regular basis the importance of the process and doing it well and in a standardized fashion, communication with nursing, communication with medicine, and to keep it high on people's priority list. Are there any questions?
Okay, I don't see, oh, okay, Dr. Chow, I see your hand up.
Yes, so thank you, and thank you for your explanation and the fact that you're working again with our physicians and the nursing staff as you described. So I'm wondering if our electronic record can or does play a role to be helpful, or perhaps it's a hindrance. I don't know, but one would have hoped that the electronic record would be sort of an integrating type of system that would be able to look at the recommendations and more easily perhaps respond to them. However, I think you've been talking about the fact that in the past this was much more extensive than just looking at a list. So I was just wondering how you are integrating your work with the electronic record. Is it helping, or it needs some fixing, or it's just not possible? And, you know, it's one of those things that we have to take as a separate item.
I think actually the process within Epic has been fabulous. It provides a lot of transparency. There's a huge amount of data that is available to providers, to nursing, to pharmacy, to everyone. From the pharmacy perspective, it's very easy to get lost, not lost, truly lost in the chart, but there's so much data to review that it can become a time-consuming process. However, the benefits, I think, have been huge. From the availability of the information, we have made some requests and received some fixes by our Epic team that facilitate some of those views so that we can do it in a more efficient way. The notes are transparent in that they are available and easily viewed by providers, nurses, pharmacists, and others. I think when our survey happens this year, I look forward to the feedback that we receive from the surveyors. I will say that when we've had pharmacist surveyors here during the pandemic, and they've done some small chart reviews related to other things, they've been very positive about the format that we're providing in our drug regimen review. So I think Epic has made it better, without a doubt.
Well, very good. I'm pleased to hear that, because that's what we would hope it would be able to help you with. So thank you very much.
Okay, any other questions? Okay, great. Thank you, Michelle.
The next item is item 7, a presentation on COVID vaccine distribution.
In some ways, this should go very quick also. It's somewhat duplicative of what Michael shared in his report, but we did want to just provide a brief update around our vaccination program. We'll look at the Wellness Hub, talk about the vaccination staff, our rates, and the plan for going forward. So our Wellness Hub, we transformed into our Vaccination Hub, and the space really, I would say, is ideal for this purpose. It gave us a lot of room. It allowed us to have people observed for 15 to 30 minutes with adequate social distancing. It's been a real plus and has served its purpose so well. We've got some pictures, and I tried to include pictures that would capture some of our clinic staff. So they've just done a fabulous job of providing vaccinations to the staff, and it's been a long process. We started December 18th, and little by little have really managed to get through a tremendous amount of staff. In the early days, we were doing almost 200 vaccinations a day. That has really dwindled, and so now our Vaccination Hub is closed most days, but we were open yesterday and today. Yesterday, we were giving second doses of Moderna vaccine. Today, we were giving second doses of Moderna and also first doses of Pfizer. So going forward, the challenge is new employees, late adopters, and so your questions earlier about people perhaps deciding to get vaccinated now that they see the benefits. And I'll say that today I received 3 emails from staff wanting to get vaccinated who had not previously wanted to. And so we're now in a period of time where I'm the centralized collector of names, and as we get enough people to use up an entire vial, then we'll schedule a day to get those folks vaccinated. Because we're working really hard not to waste doses, and I listen a lot to NPR on my commute, and about a week ago, there was a story about thousands of doses being wasted, and it's really notable that our clinic staff have done a tremendous job, and I think only in the last week have we wasted any doses at all. So they would get on the phone, and when they had no-shows, and so we had a couple extra doses in a vial, they were calling people. They were going through the list, calling people, trying to get them to come in, and did a remarkable job. So now we're collecting names, as I indicated, and we'll collect them of both staff and residents, new patients or new employees, until we get enough for a vial or two. Current vaccine supply, so we have a couple of vials left of Moderna. Our focus is now switching to Pfizer. We started with Pfizer, and then we shifted to Moderna once we got through our first supply of Pfizer. We have gotten 6 to 7 doses out of those 5-dose vials of Pfizer, as there were people did throughout the country. And so we have some Pfizer vaccine left, and that is really what we'll use going forward for our staff and our patients. We're in communication with ZSFG because they were vaccinating some folks and then they'd ship them over here, and so there's a lot of coordinating going on and when to give doses. I'll use that as my segue into the resident vaccination program. We worked with Walgreens, took a lot of teamwork. We've got great vaccination rates, and just like with the staff, we need to think about how we're going to do this going forward. So these are pictures from our time with Walgreens. Walgreens and CVS partnered with congregate living facilities and skilled nursing facilities throughout the country. Because of the size of our patient population, the volume, they gave us 2 days for each of their visits, and they came 3 times, each 3 weeks apart. The last visit, we just had them here 1 day because that was kind of a catch-up day, and we only had about 70 folks that we needed to give vaccine to on that their last visit. The teamwork, boring slide, but the teamwork is important. And the process of getting consent signed and families contacted and conversations and organizing those consents and having patients close by and then observing them, arranging to do observation for 15 to 30 minutes afterwards, and the providers being available, and also having a lot of conversations with families around consent. Just a tremendous amount of teamwork required to do this vaccination rollout for our resident population. In the last couple of days, we've given 33 more doses of vaccine. Of those 33, only 8 were actually to new patients or people that hadn't gotten any vaccine previously. So our number of residents with no doses today drops to 70. Even though we've got 8 more people, we've had some folks discharged, we've had some people expire, and so that number is always fluctuating. As I mentioned before, we're having conversations with our colleagues at ZSFG around when they're vaccinating people at discharge, or if patients were on 4A, the skilled nursing unit at ZSFG, and then transferred over here. It does require, create some logistical challenges around the vaccine and us trying not to waste any vaccine. So we're continuing to have those discussions, and we're continuing to look at every patient that comes in. Do they want to get vaccine? And have they already gotten a dose? I am hopeful. I think this is one of the places where the Janssen product really makes a lot of sense to do as people are being discharged from acute care, and that way it's only one dose, you're done. Going forward, so of those 8 patients that got vaccine, got first doses, this week, we'll be giving them second doses. As I mentioned, we're screening our new admissions, and I'm looking at those folks. Again, this is another place where Epic has really been helpful. There's been a lot of reports built to help us follow a variety of things related to COVID, including vaccination status. So we're able to run those reports and see who's new that doesn't have any COVID vaccine, who only has had 1 dose and needs a second dose. So we'll continue to put the puzzle pieces together so that we can get people vaccinated in a timely fashion. I already mentioned about our current vaccine supply. We're going to focus on Pfizer. We're in close contact with the CCC, and so if we have people come in on Moderna and we need Moderna vaccine for the sake of a resident, we'll be able, I feel confident we'll be able to obtain it. So I guess I will leave it at that. Are there any questions?
Oh, okay. Dr. Green.
So I think we've all complimented you, and well-deserved for the way you've done this. It's remarkable that you've been able to vaccinate so many people in such an efficient way. So really amazing work. I was wondering, as I looked at the slide where you have the breakdown of the neighborhoods, I know it looks like 5 or S5 was low compared to some of the others, and I wondered if there's anything in particular. 5.5, I guess it says, bad contact lenses. I wonder if there's any particular characteristics that you can identify for the units that had 96% vaccinated versus 63%.
Great question. South 5 is our COVID unit. And so some of that data is based on, they have a smaller number of patients because they have those designated beds for COVID, which are currently not occupied, thank goodness. So I don't have a sense of why they have a lower percentage. There have been patients that were hesitant that have now decided they want vaccinated. There have been families that have been hesitant and said, no, you cannot vaccinate my loved one. And those are, I don't know, maybe some of the physicians in the room have a better appreciation because I have not been part of those conversations with family members about their hesitancy. I do know, there's a couple of units that had really robust sign up for vaccine, North 3, North 5. And again, I don't know what makes them different. I think that part of North 5 is our Asian-focused unit. I know that the staff have a very close connection with the families there. I don't know if that contributed. It's all speculation. I don't know. I don't know if Wilmy or others have thoughts.
No, I do know that Southside is one of the most challenging patients in terms of compliance with the treatment plan, so that could be a factor of it as well. Right now, I don't have a clear answer.
Great, thanks. This is interesting to see the range of who's had the second doses, and whether, it's the staff interacting with the residents, whether it's peer-to-peer or whether it's family, whether there are any character or diagnoses that might vary by the different neighborhoods. That might mean some people are more able to make the decision themselves and that type of thing.
Yeah.
It's a great question, and we will use this opportunity to dig a little in it and see if we can come up with a somewhat of an explanation.
Thanks so much.
Great, okay. If nothing else, it'd be an interesting anthropological study, social anthropology study, right? Okay, great. There are no other questions that I can, or any other hands raised.
No.
So again, thank you for the report. All very good news. Looking forward to hearing and hopefully seeing 100% in these numbers soon, if we can get there. So, but I want to appreciate the pictures that you always include in your presentations. This is, not being able to be there, but being able to see these pictures of, sort of everything that you present. It's just, it's wonderful. It brings us closer, and to see even this one picture of the resident with the artwork all over their walls. It just sort of gives us, a sense of the life that they're living there at Laguna Honda. So appreciate that very much, and love having those pictures as part of the presentation.
Thank you, Commissioner. Item 8 is the closed session, which we need a motion and a vote for.
Okay.
Move to go into closed session?
Second.
All right, I will do a roll call vote. Commissioner Green,
Yes.
Commissioner Chow,
Yes.
and Commissioner Guillermo.
Yes.
Great. Give me a few seconds to switch us over. Okay, we're back. And now, Commissioners, it is time to decide whether you would like to disclose or not disclose the discussions held in closed session.
Move not to disclose?
Everyone gets muted when you come back into from the closed session to open. So I'm not sure if Commissioner Chow or Guillermo had a second to that.
Oh, I second that.
Okay, thank you. I just need to make sure we have the audio of it. Great. So I'll do a roll call vote. Commissioner Chow,
Yes.
Commissioner Green, Commissioner Green,
Yes.
and Commissioner Guillermo.
Yes.
Okay, thank you. And the last vote is a vote for adjournment, or a motion for adjournment.
Okay.
So
Is there a
moved.
motion to adjourn? Okay.
Second?
Okay.
Great. Commissioner Chow,
Yes.
Commissioner Green,
Yes.
and Commissioner Guillermo.
Yes.
Okay, the meeting is now adjourned.
Thanks, everybody.
Thank you all. And Naz, I hope you, I think we're going to make it a part of the agenda before we get started to make sure that you've eaten before we, eaten and hydrated before we start our meetings from now on. Okay. All right. Take care. Go have dinner.